The pec minor is a relatively small muscle with a big impact. When it's tight, it can be what's making your desk or computer posture harder. It can be a main factor in neck and shoulder pain, and it can even be an aggravating factor when we're talking about wrist, elbow, and forearm pain. In this video, you'll learn what the pec minor is, where it's located, what problems it commonly causes. If you watch to the end, I'm going to share exactly how you can stretch it and the common mistakes I see people make when they're trying to stretch their pecs so you can avoid them. Now, this is an interactive video, so at the risk of losing you to not come back and watch it, please watch it when you're somewhere that you can follow along with neck movements and arm movements so you can really get the full benefit of what we're talking about in this video. Hi, I'm Catherine, the founder and principal therapist at Layton Sports Massage and the creator of the Layton Massage Method. In this channel, I share simple self-care information and information about how the body works so that you can live and enjoy your favorite activities as close to pain-free as possible. Most of the time, when people think of the pecs, they think of Baywatch, bodyguards, big, muscly lifeguard people. Maybe that's just me. I don't know. But that's actually pec major. This is pec minor. Pec minor sits underneath pec major and it attaches to the third, fourth, and fifth rib. And the other end, it actually attaches to the top of the front of our shoulder blade. Now, it's important to understand where muscles attach to so that you know that when they're tight, what direction they move, and when they're loose, what direction they move, which we'll talk about in a minute. It's really important to get familiar with pec minor because it's often one of the easiest ways to help neck and shoulder pain, especially if that's posture related or from working at a computer. So knowing where pec minor attaches, and I'll put the picture back up, when it's tight, it pulls the shoulder down and forward. So whereas pec major, it comes across the front of the body and it will pull you kind of like this. That's the kind of rounded shoulders like this. Pec minor brings you up and over, which can also happen with the lats, but very often with pec minor. Now, I want to show you how having tight pec minor can create a strain on the body. And I'm going to do that by asking you to do some movements with me. But, side note, disclaimer information, number one, don't do anything that causes pain. If I ask you to do a movement and it's really sharp or painful, or even if it feels like it might be, like if your body's like, oh, maybe don't do this one, please listen to it. You may have tension already, and going into a movement may create a muscle spasm or create some sort of problem. So really listen to your body and do the movement slowly and carefully so that you don't accidentally like whip yourself around too fast. The other thing is, if you have an easily dislocated shoulder or you have a history of dislocation, maybe don't do the shoulder movement. If you've dislocated it once like a million years ago and it's never dislocated since, it's probably fine, but it's better to be safe than sorry because I don't want you to dislocate your shoulder today. So let's first talk about the shoulder. So when the pec minor is tight, it's bringing your shoulder blade up and over and down. So this is a very exaggerated pec minor position, right? Usually you can't see it so visually easily, but for the purposes of this demonstration, I'll do it so you can really see it. Now, first, open your shoulder. So open your shoulder up and bring it down and bring your shoulder blade down your back. So your chest is nice and open. And then I'd like you to raise your arm out to the side and over the head and feel what that feels like. You may get a small stretch in the front of your arm. That's fine. That's normal. But just do that a couple of times and see how easy it feels. Now, bring your shoulder up and over. So your shoulder blade is kind of being pulled down like I'm demonstrating here. Let me just show you from the side. Yeah. Now I want you to raise your arm. That's really difficult, right? I cannot get my arm past here. Like physically, I cannot. Now, obviously, I'm demonstrating an exaggerated version of this. You probably aren't walking around with your shoulders like this. Hopefully you're not walking around with your shoulders like this. But if you have a little bit of that, then you have a little bit of the wrong muscles lifting your arm up. Smaller muscles that are maybe only supposed to start what this is called abduction, and aren't really supposed to be responsible for it. So you can get like pains along here because your shoulder is being pulled down and forward. I see lots of guys who do like overhead press and any kind of shoulder movement where your arms are going over your head, and they're getting pain in their shoulder, in the top of the shoulder, sometimes in the joint. And it's because pec minor is tight and it's pulling their shoulder around. Now, we've done the arm, we've done the shoulder. If you have pain in the top of your shoulder, pec minor is one of the most usual culprits of that. Second, neck. So if you get a pain in the neck, like here, and sometimes in the back of the neck across the back, it can be because pec minor is pushing your head forward and these muscles are having to work harder. So again, roll your shoulders forward, but now let's do it right. So open your shoulders and bring them down and do neck rotation. And notice how that feels. Wow, actually, I think I need to get my pec minors released because that felt a lot better than my rotation usually does. Now, if you have tight sternocleidomastoid, which is this muscle here, tight scalenes, you may still be pulled forward. So it might not be perfectly frictionless. But now, even just a tiny bit, let's not exaggerate it as much. Just bring your shoulders forward and down a little bit, trying to contract through here. Yeah, that's immediately harder. Like my neck doesn't even want to do this. How does your neck feel? Let me know in the comments, with the shoulder as well. How did your shoulder and neck feel compared to having your shoulders down and open? And versus like this and raising your arms and turning your head. Let me know. Let me know how it feels to you. Or if you can't do it because you have so much tension. So when the pec minor is tight, that's what it's doing. It's pulling the shoulder blade up and over, and the whole arm and the neck is trying to work against basically being pulled forward. I mean, imagine a 2-year-old wrapping their hands around the back of your neck and pulling you forward, and that's basically what your pec minor is doing. Not only that, but it can also be related to wrist and shoulder, elbow, wrist, and hand pain. I worked with a musician and he would drum. And we actually realized that his recurrent wrist pain, which had been a problem for months, he'd even have to take time off to rest it. When we put his shoulder back in the right position and it wasn't being pulled forward and it was up a little bit as well, he was actually able to drum for hours and hours and hours if he kept his shoulder in the right position and not get the wrist pain. So in that case, it was definitely the shoulder girdle, not just pec minor, but some other muscles that were pulling it out of alignment and creating a strain on the wrist. Because here's the thing, when your shoulder is not in the right position, everything down that line is having to work harder to compensate. So if we can get your shoulder girdle relaxed and in the right position mechanically, first of all the nerves that are coming down the neck have a better pathway because they're not kind of being, I don't know, irritated, impinged, compressed, whatever you want to say, down the arm, but also the movement is better. Now, obviously, carpal tunnel and any pain in the body can be created by a lot of different things, but this is just from my own experience working with people who work at a desk and who have shoulder pain and neck pain over the last 10 plus years. This is a really common occurrence. Now, usually pec minor gets tight with pec major, with the lats, with serratus anterior, with the rotator cuff. So we do have to look at the whole system. But pec minor is very often the cause, and it's very often underlooked, overlooked, underrated, one of those words, because it's not as popular as pecs and lats, like and rotator cuff, the ones that everybody knows. So now that you know all the things what we can do, I want to, or what the pec minor being tight can do, I want to explain to you how to stretch it, because people make a lot of mistakes when they're trying to stretch pecs because they just think about pec major and not pec minor. But before I do that, I would like to have my obligatory, can you please like this video? And if you know anybody who has neck or shoulder pain or who has difficulty sitting at a computer, having good posture, please let them know about this video and share it. It is greatly appreciated. We do have a free desk workers group, Facebook group. If you would like more support, please join that. I'll add the link below. And now back to the stretching. So again, because we know where pec minor attaches, we know how we need to stretch it, right? We basically need to bring the shoulder blade away from the third, fourth, and fifth ribs, which is hard to do, right? It's not as easy as opening up our shoulder is for pec minor or bringing our arm up over our head for the lats. But here's the mistake that people make when they stretch the pecs. Have you seen this one before where you clasp your arms behind you and then you lift up? Now, because you've just watched this whole video, I bet you automatically know what the problem is with this stretch. I'll give you a second. Let me know in the comments if you know the answer. I almost don't want to tell you so I can see who knows in the comments, but I won't do that. Yes, if you said it shortens the pec minor, you win the gold star or the silver star, because I prefer silver to gold. When your arms come down like this, yeah, you are stretching some of your pec fibers that go across the chest. But pec minor, when it's short, it goes like this. So you're really just shortening pec minor when you're trying to do that stretch. So you're stretching some of your pec major fibers, but not pec minor. So how do you stretch pec minor? So the number one stretch that I give people for pec minor, it's super easy and very, very gentle, but very effective. So you can test how effective it is by starting by doing an arms out to the side and over the head. I always recommend when you do a stretch that you test it before and after, because by testing you see if it's effective instead of having to rely on the feeling of stretch, because we don't always get the feeling of stretch, especially with really tight muscles. All you do is you would find, maybe I'll leave this side, you would find like a doorway or something that you could put your hand on. Have your arm at about 90 degrees. It's okay if it's lower, if it hurts your arm to be higher. You should have no pain in the back of the body. And you put your hand right here, right where pec minor is. And then you just breathe. And as you exhale, you allow your shoulder blade to drop down. Now what you can do is you can push and you feel that it feels a little bit taut, like there's some resistance underneath. And as you exhale, you let go of it and you'll feel it soften. So like even just with those 2 breaths, it softened a little bit. And the reason that you want to hold on to a wall or a door frame is because you don't really want to just hold your arm up in the air. And then you do the test again. And actually already that feels easier for me just after 2 breaths. I swear, I'm not making it up. The thing to remember when you do this though, don't let your shoulder like come out. What will happen sometimes is because this is a bit of a stretch, people kind of do this with their shoulder, try and keep it down. If you're not sure if you're doing it right, you can have an in-person session with us in one of our clinics in London. You can book an online video session with us because we are still doing those even though we're not locked down at the moment. And we can walk you through the stretches and the self-care exercises and other stuff for whatever the reason that you need to stretch your pec minor is. Okay. That's how you stretch it. Now you know how to stretch pec minor, where it is, and what it commonly causes. So we have covered pec minor for Muscle of the Month. I hope you've enjoyed it. Let me know if you have any questions, and I will see you in the next one. Bye.